Hi, my name is Sarah. I'm going to be your student physical therapist today. How would you like to be addressed?
As Scott.
Scott? Perfect. Okay, so before we get into the reason that brought you here today, I wanted to ask if you had any past medical history that you'd like to tell me about.
I broke my arm about 5 years ago.
Okay. And that healed okay? No current issues with it?
No problems.
Are you taking any medication?
Advil.
Okay, and is that for the back pain?
Yes.
Okay, does it help at all?
A little bit.
Okay. And have you seen a doctor for this issue before coming to see me?
Chiropractor.
Okay, you see the chiropractor. How often do you go see them?
About 2 to 3 times a week.
Okay, does that help?
A little.
Okay. And so how long have you been having the back pain?
Approximately 3 weeks.
Okay. And did anything cause it?
No, not that I know of.
Okay, so would you say it came out of nowhere, slowly got worse?
Slowly got worse.
Okay. Can you show me exactly where it hurts?
Kind of like in the lower back in the middle.
Okay. Does it ever travel anywhere else down your leg at all?
No.
Okay. So on a scale of 0 to 10, 0 being absolutely no pain, 10 being you have to go to the hospital, where would you say your pain is at right now?
Right now, maybe a 1.
Okay. And at its best?
0.
Okay. What are you normally doing when it's at its best?
Moving.
Okay. And what about at its worst? What would you say it is on that scale?
The worst, the pain level, about a 5.
Okay, and
5,
what are
6.
you doing around that time?
When I sit still too long.
Okay. Do you ever have any numbness or tingling?
No.
Does it hurt when you cough or sneeze?
No.
When you go from sitting to standing?
No.
Do you ever hear any audible sounds in your back?
Occasionally, yes.
Okay. And do you ever, crack your own back?
Sometimes.
Okay. Okay. And so what do you do for work?
Teacher.
Okay. And does this affect you at work at all?
Yes.
How so?
When I'm sitting at the desk too long.
Okay.
That's when it bothers me the most. If I'm up walking around, it's fine, but if I sit too long, it hurts.
Okay. Does it ever bother you if you stand for too long?
No.
Okay. Does it ever bother you around the house?
Same thing, like if I'm sitting and watching TV or if I reach up too high in the cupboard that's above my head.
Okay. And does it affect your job other than just sitting? Does it affect any of the responsibilities you have to do?
No.
Okay. And any hobbies, does it bother you with them?
I play golf if I sit in the golf cart too long. Okay. Moving, swinging, everything's fine. Just if I sit too long.
Okay. And does it ever bother you when you sleep?
No, I toss and turn.
Okay. Is that because of pain?
Probably.
Okay. And is it better in the morning versus the night at all?
No.
Okay. Okay. And just some general screening questions that I'd like to ask you. I ask all of my patients with low back pain. Have you had any bowel or bladder issues?
No.
Okay. Any fever, unexplained weight loss?
No.
Okay. Is there anything else you'd like to tell me?
Nope.
Okay, cool. So we're going to start the examination. Just some physical things of how you're doing and stuff like that.
Okay.
So the first thing I'm going to ask is it okay if you take your shirt off?
Sure.
Okay. Go ahead and do that for me. Okay. And then go ahead and sit towards the edge of the bed, have your feet on the floor. Good. Okay. Just looking at how you're sitting. Okay. Can you go ahead and stand up for me? Okay. Go ahead and face that way for me. Good. Okay. So now I'm just going to take some measurements. Okay. So I'm just going to find the spot on your back and I'm going to put a little mark with pen. Is that okay?
Yes.
Okay, I'm just zeroing it out to see where you're standing posture-wise. Okay. 26 degrees. And then bottom one. About 20. Okay, can you go ahead and bend as far forward as you can?
Over?
Yep.
Touching the ground?
Yes. Okay, go ahead and come back up. Okay. I'm gonna have you do that one more time. Okay. You feeling okay?
Mm-hmm.
Any pain with those?
No.
Okay. So the next one. So can you put your hands on your lower back for me? So I'm gonna have you palm on your lower back. Yep, both hands. Just like that. Perfect. And can you extend back, bringing your hips forward slightly as far as you can? Okay. Good. Go ahead and come back up. Okay. Just one more. Yes, you can go ahead and relax. Okay, so with your hand on your side, just flat on your side. Yep. I want you to just bring your hand down your leg as far as you can, bending your back. Yep. Good. Fine. Okay, come back up. Okay, and then the other way. Good. Back up. Okay, you can go ahead and sit back down. Okay, so we're just checking your range of motion there. Most of them are normal, slightly more than normal, which is okay. The next thing I'm going to do is just a couple more tests. So can you go ahead and come forward so your feet are on the ground? Perfect. So I'm going to have you raise this knee off the ground and don't let me push it down. Good, relax. Same thing with this one, lift it up. Don't let me push it down. Good, relax. Extend this leg for me, straighten it, good. Don't let me bend it. Good, other leg. Good, don't let me bend it. Good. So with your feet flat on the ground, go ahead and bring your toes up. Yep, down. Keeping your heel on the ground, bring the ball of your foot up off the ground. Good, don't let me push it down. Good, other one. Don't let me push it down. Good. Then just your big toe, bring that up for me. Can you do that? Okay.
Not that one.
Don't let me push it down. Good. Can you can bring the other toes up too. Don't let me push it down. Okay. Good.
I can't bring that big toe only.
Okay. So you can go ahead and scoot back on the bed a little bit. So bringing your foot out this way.
Mm-hmm.
Don't let me push it in. Good. Same with this foot. Bringing that out that way. Don't let me push it in. Good. Okay. And then I'm going to try and straighten your knee. Don't let me. Good. Other leg. Good. Okay. Everything's good there. Nice and strong. So I'm just going to check your reflexes real quick. So it's just going to be a small tap. Shouldn't feel any pain. Your leg will probably move. Can you do me a favor? Put your hands together like this and go ahead and try and pull them apart and close your eyes. There we go. Okay. Good. Other side. You can go ahead and relax. Okay. Go ahead and do that again. Close your eyes. Good. Okay, so one more. This time it's going to be on the back of your ankle. Go ahead and relax. Yep. Okay, do the same thing with your hands again and close your eyes. Okay. Good. Okay. So the next thing I'm going to do is just check your sensation. And so I'm going to have you close your eyes for this. You don't have to do that yet. Can you go ahead and put your palm straight up? It should feel like that. You can feel that.
Okay.
Okay? Yes, you can feel that? Okay. So I'm going to touch both sides of your leg. Or both legs at the same time. Let me know. Just say yes when you feel it, and if they feel any different, let me know.
Okay.
Okay. So hands off to your side.
Oh, like this?
Just
or...
on the bed. Good. And go ahead and close your eyes. Are you feeling it?
Oh, I'm supposed to say I feel it. I thought
Yes.
if I feel a difference. Okay, gotcha.
Yep.
Yes,
let me know
I
that you feel it,
all right,
and
gotcha.
then if you feel a difference,
Okay.
let me know. Okay.
Yes, I feel it. No difference. No difference. No difference. No. Felt like that one went a little quicker, but a no.
Okay.
No.
Can you scoot forward a little bit on the bed? Yep. Relax again.
Felt it.
Okay. Good. All done. And you were able to feel all of them. And of course, there's a little bit of human error there with me going a little fast on one versus the other. Okay. So now we're just going to see how you do with some muscle performance stuff.
Okay.
So I'm going to have you lay down on your back for me. Good. Okay. And then go ahead and bend your knees and bend your hips so that your feet are off the table or the bed. Good. Hands behind your head for me. I don't want you pulling on your head, but go ahead and do a crunch and hold it there. Good. Go back down. So that's where I want you to hold it, okay?
Okay.
I want you to hold it for as long as you can. Okay. Go ahead and lift up.
maximum time we can go to?
3 minutes.
Okay. I can do that. How it's open?
2:30.
Oh yeah.
Okay, go ahead and relax. Good. Okay, so I'm going to give you a little break. The next one we're going to do is I'm going to have you on your stomach. Let me get this stuff for you. Okay. So, can you go ahead and lift your hips up off the bed for me? Good. Right there. Perfect. Okay, so hands at your side. Are you ready to do the next one? Or do you need a break?
Depends what it is.
So I'm going to have you lift your chest up off the bed.
Just my chest, like that?
Yep. And hold for as long as you
Okay.
can. Okay?
Give me 10 seconds.
Okay.
So my feet stay down?
Yes, your feet
Okay,
stay
so
down
feet
and you
stay
just
down, just
lift
pick
your
my chest
chest.
up.
Yep.
That won't last as long. Okay, I'm ready.
Whenever you're ready, go ahead.
That's cheating though. Doesn't matter which way my head is, right?
Nope.
Okay.
Okay, you can go ahead and sit up on the side of the bed.
Ow.
You okay?
Yep. Okay.
Okay. Okay. So, as you probably know, the endurance on your extending your back was a little less than your flexors. So we will work on that in coming sessions.
Okay.
Just 2 more things. We're going to go through a repetitive motion. So I'm going to have you go ahead and stand and face the mirror. Yep. Okay, good. So what I'm going to have you do is go down. You're going to bend forward as far as you can and come back up. We're going to do that 5 times.
Okay. Ready?
Yep. Good. And back up. 1. 5
Again?
times.
Okay.
I didn't know if I had to wait for you to say go.
2, 3, 4, 5. Good. And so from where your back pain is normally, did it travel at all? Did it increase in pain at all?
No.
Okay, 5 more times. Good. Did the location of the pain change? Any worse, better, same?
Same.
Okay, 5 more. Good. Good. Worse, better, same.
Same.
Did it travel into your legs at all?
No.
Okay. So the same thing as when we were testing, measuring your back extension. I want your hands on your back like this. You're going to bring your hips slightly forward, and you're going to extend your back as far as you can. Yep. Good. And come back to center 5 times. Good. 2 more. Good. So is the pain in the same place?
Yes.
Any worse, better, same?
Nope.
Same? Okay. 5 more. Good. Good. Worse, better, same?
Same.
Any into the legs?
No.
Not into the butt?
Nope.
Back of the leg, foot at all?
Nope.
Okay, 5 more. Five. Good. Worse, better, same?
Same.
Okay. That was 3. That was 3. Okay.
Yep.
So, last thing I'm going to have you do is lay on your stomach. Okay. Arms at your side. Yep. Then you're just going to relax. I'm going to lift your legs up. And when I do, I just want you to let me know if there's any change in your back symptoms, okay?
Okay.
How's your back right now?
Fine.
Okay. Any change?
Nope.
Okay. You can go ahead and sit up at the edge of the bed. There is your shirt and glasses. Just going to go over what I found with you. So I think you have some lumbar instability, which lumbar is your lower back region. Instability, you have a lot of movement, and that's why when you sit for too long, you feel the need to move.
Okay.
So everything was good with the nerve testing that I did. That was with the sensation, the reflexes, and the strength of your muscles. Everything was good there, no issues. Posture is a little off. We're going to work on that in the next coming treatment session. And we're going to work on the endurance of your back extensors. That way we can get them up to around the same endurance strength as
Okay.
your flexors. And yeah, we're just going to work to make it so that you're able to sit for longer periods of time and keep your back stabilized.
Sounds good.
Cool. Thank you.
Thank you. If you told me that it